What are antidepressants? Psychoeducation Today, video created by Dr. O, and antidepressants are medications used to treat depression. In some cases, healthcare providers may prescribe antidepressants to treat other health conditions, such as anxiety, pain, and insomnia. Commonly prescribed types of antidepressants are selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, norepinephrine dopamine reuptake inhibitors, NDRIs. These medications are commonly prescribed because they improve the symptoms of a broad group of depressive and anxiety disorders. They are also associated with fewer side effects than older antidepressants. Although older antidepressants, such as tricyclics and monoamine oxidase inhibitors, MAOIs, are associated with more side effects, they may be the best option for some people. Antidepressants take time, usually 48 weeks, to work, and problems with sleep, appetite, energy, and concentration often improve before mood lifts. Giving a medication a chance to work is important before deciding whether it is right for you. Common side effects of SSRIs and other antidepressants include upset stomach, headache, or sexual dysfunction. The side effects are generally mild and tend to go away with time. People who are sensitive to the side effects of these medications sometimes benefit from starting with a low dose, increasing the daily dose very slowly, and changing when or how they take the medication. For example, at bedtime or with food. Esketamine is an FDA-approved medication for treatment-resistant depression, which may be diagnosed when a person's symptoms do not improve after trying at least 2 antidepressants. Esketamine is delivered as a nasal spray in a healthcare provider's office, a clinic, or a hospital. It often acts rapidly, typically within a couple of hours, to relieve depression symptoms. People usually continue to take an oral antidepressant to maintain the improvement in their symptoms. Combining antidepressants with other medications or supplements that act on the serotonin system, such as triptans, often used to treat migraine headaches, and St. John's wort, a dietary supplement, can cause a rare but life-threatening illness called serotonin syndrome. Symptoms of serotonin syndrome include agitation, muscle twitches, hallucinations, seeing or hearing things others do not see or hear, high temperature, and unusual blood pressure changes. For most people, the risk of such extreme reactions is low. It is important for healthcare providers to consider all possible interactions and use extra care in prescribing and monitoring medication combinations that have an above-average risk. Note, in some cases, children, teenagers, and young adults under 25 may experience an increase in suicidal thoughts or behavior when taking antidepressants, especially in the first few weeks after starting the medication or when the dose is changed. People of all ages taking antidepressants should be watched closely, especially during the first few weeks of treatment. Reference National Institute on Mental Health.